Welcome, everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 5 new cases of COVID-19 in Windsor and Essex County. 2 are close contacts of confirmed cases. 1 is community-acquired, 1 is travel-related outside of North America, and 1 case is still being investigated. We've had 16,790 cases since the beginning of the pandemic. 54 people are active at this time, with 14 of our active cases being a variant of concern. To date, 1,944 confirmed or preliminary variants have been identified in Windsor-Essex County. 7 people are currently in the hospital and 5 people are in ICU. Our community has lost 434 people to COVID. The good news is that there are currently no active outbreaks in Windsor and Essex County. Now for our vaccine update, 270,030 people have received at least 1 dose of a COVID-19 vaccine. Overall, 73.7% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. 34.9% of our adults 18 years of age and older are fully vaccinated with 2 doses. Currently, those who received their first dose of an mRNA vaccine on or before May 9th are able to book for their second dose of an mRNA vaccine at a mass vaccination clinic, pharmacy, or primary care provider. In addition, we would like to remind our residents that with the exception of our 12 to 17-year-old youth, anyone who books a first dose or second dose of an mRNA vaccine will be guaranteed an mRNA vaccine, which could be either Moderna or Pfizer. We did receive our shipment of Pfizer this morning and will continue moving both Moderna and Pfizer at our mass vaccination clinics. Currently, we are booked until July 2nd, with the exception of a few spots here and there at Libro and Nature Fresh. Today, along with community partners, first and second doses will be provided to those experiencing homelessness in the City of Windsor's downtown core. In addition, we continue with second doses for our temporary farm workers at Nature Fresh in Leamington, which should be completed by this Friday. To book your appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Today we have achieved another significant milestones. After more than 8 months, today we don't have any active outbreaks in our region. There was a time in January when we had 53 active outbreaks in the region. We now only have 54 active cases. Our vaccination rate is one of the highest in the province, with almost 74% of our adults receiving at least 1 dose, and almost 35% of our adults are fully vaccinated. This was not easy for any of us, including our staff. Our community has suffered a lot due to COVID-19. Our staff worked tirelessly to keep our community safe. As an organization, we experienced many challenges, external challenges as well as internal challenges. But when I look back on what we have accomplished, it makes me feel proud and lucky to be part of the Windsor-Essex County Health Unit. I am lucky to be part of an amazing and dedicated team of staff, and more importantly, the amazing leadership team. Teresa Marintet, our CEO, is one of the strongest leaders in the community that I have seen so far. Even though she is a very private person, but her passion to serve the community, her love for this community, is something that is clearly evident. Teresa grew up in Windsor and spent more than 30 years of service at the health unit. She joined the health unit as a public health nurse in 1989, worked in several departments, such as school health, infectious disease, and oral health. She served as manager in some of these departments before finally becoming the director for Health Protection Department and assumed the role of Chief Nursing Officer in 2013. I joined Teresa in August of 2014 and worked alongside her to address the health protection issues. During the pandemic, since I didn't have any associate medical officer of health, because of her strong nursing background and exceptional understanding of public health and the decades of experience, she was practically supporting me as the associate medical officer of health. I always saw her and respected her public health advice in every challenges that we have faced together throughout my time at the health unit, either it was pre-pandemic time or during the pandemic. I have learned a lot from Teresa, and I've always seen us as the dynamic duo to take the burden of responsibility to keep our community safe. Teresa has worked nonstop for our community. Her focus and commitment has never wavered. I feel our community is losing a great leader, a great advocate for public health. Most importantly, I'll miss her as my colleague. Teresa, I wish you all the best after an incredible 30 years of journey with the health unit, and I'm truly honored to present this plaque on behalf of our health unit to Teresa. And even though this is only a plaque, but please know that you have done a lot for this community, for the organization, and you will stay in our heart forever. I want to truly thank you for everything you have done for this community. Thank you, thank you, thank you.
Oh, wow. Obviously not expected, but yeah, I'm speechless. But I just want to thank our health unit and Dr. Ahmed. We have grown very close, as you can tell. No one predicted this pandemic, and I don't know, I'm speechless, honestly. It's just, thank you for the recognition. I don't deserve it. You know, there's so many people behind us working all the time, all of our community partners, all of our staff here at the health unit. I might have been someone that you've seen throughout this past year, but so many people have supported our community, and I'm happy to have been part of it and to serve the community and try to focus on what's important and prevent people from dying from COVID. And it's been great working with Dr. Ahmed. We have a very great senior leadership team. Everybody is, just have been amazing. So I appreciate this. It's very nice. I don't like a lot of attention, and there's been a lot of attention, but thank you.
Thank you, Teresa.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning, and congratulations on your retirement, Teresa. We'll miss talking to you daily, or a couple times a week anyway. You were cutting out a little bit in the beginning. I just want to reiterate, you said you received the shipment of Pfizer that was delayed?
Yes, this morning we did receive the Pfizer vaccine, and one of our staff is out collecting it right now. Like, we have a central location, and as you know, we share the vaccine supply with Windsor Regional Hospital, so they can continue with their site, and we'll use the vaccine as well. So it is here.
And so you're still telling people they're guaranteed either one or the other, but both will be available at the vaccine clinic moving forward?
So the direction that we gave on Monday will continue. So anyone getting first doses, 18 years of age and older, will continue to get Moderna as their mRNA vaccine for a first dose. First and second doses for those 12 to 17 years of age must be Pfizer at this time. So that will continue. So any day, every day, we make sure that we are providing that to the clinics. Second doses for anyone who received an mRNA vaccine, whether it be Moderna or Pfizer, will get either Moderna or Pfizer. So that isn't guaranteed. They'll get whatever is being stocked at the clinic, and so they won't know that in advance. Knowing that Moderna and Pfizer are interchangeable, great coverage with both vaccines, and no worries there. Second doses for those who received their first dose of AstraZeneca, and this is 8 weeks ago, and want a second dose, would like their second dose to be an mRNA, are going to receive Moderna. Because in the coming weeks, we will get more Moderna than Pfizer. So we are preparing everyone that Moderna will be our primary vaccine and using both.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. First, I'll say, Teresa, congratulations.
Thank you.
Second of all, just to move on to the mayor's open letter to you, Dr. Ahmed, yesterday, talking about vaccine coverage in certain neighborhoods of Windsor and his concerns about increasing that coverage. What's your response to the mayor, and what is being done to ensure that more people in the downtown and Fontainebleau neighborhoods specifically are getting those first doses?
So I'll start off by saying that, of course, I present that data every week, and our team is aware of that information as well. And it's unfortunate that I have to see this type of letter coming my way. Don't know what purpose is those official letters are, because I've never received any other communication officially from the mayor. And immediately after, it's out in the media, so it's unfortunate. But what we have done so far, obviously, we recognize the hotspot neighborhood, high priority neighborhoods for various reasons, and we have talked about it many times about why these high priority neighborhoods are important to target for COVID and also for vaccination. More than 2 months ago, or close to 2 months ago, we have had a number of conversations with the ministry. We were able to advocate for a funding for our region, specifically targeting for these hotspot communities for various initiatives, including the initiative to support the families, the people who are impacted by COVID in a disproportionate way, recognizing that there are many social determinants of health issues that are affecting these neighborhoods. So there is a dedicated funding that is coming to our health unit in excess of more than $660,000 that are coming to our health unit with our advocacy work and with the support that we are providing. That there is a lead agency in this region, which is the Canadian Mental Health Association, that has received the funding, and one of their key partner is the City of Windsor Social Services. So again, that's something that the city is already engaged and involved with. So I think maybe something that the city should look into what they are doing. And since the funding has arrived here, we have been working closely with them as the public health partner. And it's not, as I mentioned, it's not just about the vaccine. Access to vaccine has been there for some time now for them. So it's not an access issue. And just to give you some idea and some perspective, that we have at least 46 physician offices that are currently offering and administering vaccine in these hotspot community, which is, 15 of these physicians' offices are offering these vaccines at these hotspot community by postal code. And we have a lot of physicians providing these vaccines. And on top of that, pharmacies, there are 34 pharmacies that are located in the hotspot. And just in the city of Windsor, there are 24 of these pharmacies are located in the city of Windsor that are providing the vaccine. We have done pop-up clinics, and in total 10 across Windsor and Essex, 7 already held in Windsor, and 3 are planned in the city of Windsor. From a mobile clinic perspective, we have completed 22 mobile clinics in the city, and 4 are planning to complete the second dose, so in total there are 20 of them in the city of Windsor that we have done. So this is on top of everything that we have done, along with the partnership with the Multicultural Council of Canada. There are other community agencies that are working to create languages and resources in different language. What they're missing is some of these outreach. Access is not an issue, it's an outreach. It's an outreach to ensure that who are hesitating the vaccine, what are their reasons. Maybe they have other reason that goes beyond the vaccine issue and that needs to be addressed. Those are issues that we, as a public health, we see the impact of it, but don't necessarily control directly to those issues. There are various agencies that do the outreach work. There are many players that are already involved, and it's been working. So I think I have explained all of these to the mayor yesterday in my call with him, and it would have been much easier to have a one-on-one conversation like these to address this issue. So it's unfortunate that there is this impression that public health is not doing anything for this hotspot community, and I want to make sure that this is not an issue that obviously that we are not paying attention to. We do. And there's a lot of work that we have done and will continue to do that. Public health is one of the agencies that we talk about the equity all the time. So, and again, don't want to make it sound anything more than that, but I would just leave it there that we always talk about the equity. Sometimes people don't even talk about equity, and it's unfortunate that the good work of what is happening, it's being. I'll just stop here. Sorry.
Okay, so is it fair to say that if the efforts being done to target those communities weren't happening, weren't ongoing, we would see much lower vaccination rates in those areas than we are already?
Absolutely, and I think we definitely, as the Marpap's Health, I would definitely say that still there is more work that we need to do in these community, and there are targeted efforts that are happening even right now as we speak, and will continue to happen. The uptake will not be as quick as in the other region, but we are targeting these community to increase the uptake. It would require more dedicated support, which we are doing with the additional funding that are coming to the region, which again, the city is already partner of. We should be able to increase the vaccination rate in these community, and that work is ongoing and will continue to happen even beyond when the overall, let's say the mass vaccination clinics and everything else, even if it's wrapped up, we will still have a lot of work to do with working with these partners to increase vaccination rates in these regions.
When you say uptake won't be as quick in those neighborhoods, can you speak to that more? Is that because they require more in-depth conversations about why it's needed to get the vaccine? Talk about that.
Well, as we know, the engagement part, right? So for in public health, when we are talking about any kind of initiative, any kind of efforts, it does require many different levels, skills in terms of, and the priorities as well. So when we're talking about any kind of health messaging, it requires health literacy. What are the health literacy issues that they are dealing with? What are some of their understanding about the vaccine, about their pandemic? And then when you go back to the social determinants of health, many people, there are income disparity. There are people who are more concerned about their income rather than thinking about, okay, what do I need to do to take my appointment off to get to the vaccination clinic, and whether feeding my family is more important than getting the vaccine or not. So those are some of the real issues that needs to be addressed, and there needs to be different support system in place to do that. Also, access to the information. So our community has access to, everybody in the region has access, because the COVID-19 pandemic is not an isolated event that people are not aware of. And if they're choosing not to get the vaccine, what are some of those reasons? How do we address those reasons? Those require some of that connection and connectivity with the organizations and agencies that already work with them. There are many outreach agencies that work with them. What they need is, with the dedicated funding, is the actual outreach, maybe having more outreach worker, reaching out to them, addressing their issues, maybe finding support, maybe providing them with some kind of income support, providing them with some other type of benefits. Those are some of the work that are currently in progress. And it does require more, I guess, direct one-on-one type of contact with some of these families and neighborhood. It's not just, we have done that, and as I mentioned, there are already these mass targeted, these mobile clinics are happening in this region. There are other pharmacies that already have the vaccine, so access is not an issue. I think it's more of the connection, which is happening and will continue to happen, and it takes time.
Thank you.
Any questions from AM 800?
Dr. Ahmed, going back to the outbreaks, like you mentioned, the milestone, just talk about from January, like you mentioned, to now, a lot of work has been done, but I'm guessing when there is an outbreak, that puts added pressure on these facilities, obviously, but you and your team as well?
Definitely. Every time when an outbreak is declared, obviously it forces the employer to make a number of changes to keep their employees safe and keep any of the people who are accessing these businesses safe. Our staff obviously had to go on site to do some inspection sometimes. Sometimes they do off-site investigation depending on the type of facility. And there are recommendations. There's ongoing conversation dialogue that happens every day with the facility to ensure that they have all the appropriate measures in place. It does take a lot. Some outbreaks are easy to deal with. Some are much more complicated, especially with larger organization or with much more complex interconnection with the staff and their connectivity. So we have to truly, take each and every step of what they do, how their business is operated, and how it impacts the ongoing transmission of COVID-19. So definitely a dedicated resource that we need to engage and involve our environmental health team on top of our case and contact management team to support the outbreak process. So far, our staff have been amazing in managing many of these outbreaks. So I'm really hoping that with no outbreaks in the region, they will give them some time to relax and hope that we don't see any more of these COVID-19 outbreaks with all this high vaccination coverage rate and with the decreasing transmission in the community.
Is it safe to say we no longer have active outbreaks due to the vaccine, but also obviously health officials and these businesses following all the safety measures?
Well, definitely. I think it's a combination. So nothing can work in isolation, even if you have high vaccination rate. But if there is ongoing transmission that's happening in the community and if people are not following these public health measures, you will still see that there may be, some adverse, outcome of COVID in the community, just because of the, even we're taking Pfizer or Moderna or the mRNA vaccine, which is very effective vaccine, more than 94-95% effective, but there's still that 5% or 6% you can say that maybe the vaccine may not be effective in those individuals. So even if it continues on, you can still see that the transmission is ongoing and there may still people who will die from it. So I think it is important from that end. And obviously, if the employers and all these workplaces, they are not following these public health measures, it will lead to an ongoing transmission. So I think we have learned a lot throughout this pandemic. And as much as, everything has an impact in the entire community, businesses and organizations have suffered quite a loss as well due to COVID. And they are motivated to take some of these measures. So I think overall, it's a complete collaboration between the community, the businesses, the organization, the high vaccination rate, good case and contact management, outbreak control measures that has got to us to this point. And we hope that it just continues. Honestly, I'm sure no one, including myself, want to see these cases increase or we go back to where we were. So again, as a message, please make sure that you continue to follow some of these public health measures and also get your vaccine as quickly as possible if you haven't done that already.
Switching gears, Teresa, to the vaccine. Just looking here, obviously on Monday, the health unit reported for single dose 73.4 and then today 73.7. Have we hit a brick wall with individuals seeking their first dose? Obviously the second dose percentage is climbing, but it seems like the first dose is staying still.
We are still administering first doses, but you're right, it is slowing down. But even yesterday at the initiative for the people experiencing homelessness, they did do over 20 first doses. So that's good. So the first doses are smaller numbers, but they continue to occur. We are also working on our 12 to 17-year-old vaccination rates, where we're not as high as we'd like those to be. And so hopefully you'll see an increase of first doses, because we do have, people are booked, like I said, till July 2nd, and that's a mix of first and second doses. So it's going up, but slowly.
Do you have the percentage in front of you for 12 to 17?
I don't have it in front of me, but I believe it is around 44 or 45%. I know Dr. Ahmed's
Thank you.
looking for it.
Perfect, thank you.
Okay. Any questions from CTV?
Yes, good morning. What percentage of vaccine coverage do you think that the region will reach?
So we already are at 74%, close to 74% officially, and we anticipate that at least we have more than 2 to 3% of our community who are vaccinated in US, and we haven't officially recorded their vaccination record in our community. So in my understanding, we are at 76 or 77% of the coverage rate with at least one dose. And that's a pretty good coverage rate. I initially targeted anything, obviously I would want to, if possible, 100%. But anything more than 70% was something that I felt that it's important to achieve. So it's important and critical that we achieve at least 70%. I hope that with the current rate that we're moving, we should be able to hit 80% target. And then again, as we talk about some of these high priority neighborhoods, high priority communities, there will be more work that needs to be done. So maybe we can push it further even into in the 90s. So in the short term, our goal was to get to 70%, and we are pushing it towards the 80%, which is pretty much the average in the 40 plus group, the younger population between 20 to 40. That's the group that has a slightly lower coverage rate than the other age bands. So we need more messaging, we need more campaign to engage them. But I think I want to say I have a short-term and a long-term objective. Short-term objective is to get us to 80%. Long-term objective, anywhere more than 90% would be the coverage rate that I'm looking for.
Okay, thank you. And are there any reports of people turning down Moderna at the clinics when they thought they were going to get Pfizer?
Well, I think it is happening. I don't have the exact number that how frequently it is happening. And again, I fail to understand that what is the rationale, even though when it is exactly the same vaccine, the side effect profile, the safety profile, the effectiveness profile is exactly the same. So it's unfortunate that people are hesitating when there is practically no difference. So I don't have the number, but I truly think that we shouldn't get into that hesitancy at this stage when we are getting better. The only reason that we are better is because of our high vaccination coverage rate, and we definitely don't want to give any mixed messages to anyone about the safety and the effectiveness of this vaccine. They are both the same vaccine with same side effects profile, safety profile, effectiveness profile. Everything is exactly the same. So do not hesitate if that is happening. And again, this is not new. And again, I just want to remind that this is not new. Vaccine interchangeability has been happened even without maybe people were aware of it. So it's we are giving full disclosure in terms of who is getting what and what kind of vaccine. You always have a choice, but do not hesitate just because of any concerns specific to one brand of the vaccine versus the other.
Is there any update on guidance for fully vaccinated people, or are you still waiting for national guidance?
Well, obviously, those are the issues that I particularly don't have any control over. There will be a national or provincial guidance with these individuals, and so far I haven't seen anything coming out from the federal government or from the provincial government. So the recommendation stays, but I anticipate that there will be lesser restriction for people who are fully vaccinated, and it should happen soon. I think there's enough evidence that is giving us the level of comfort that we need when we are talking about people who are fully vaccinated, and the risk that is associated with them in terms of transmission or developing any severe disease when they're fully vaccinated.
Okay, and switching gears a little bit just to the reopening, as Ontario has hit vaccine targets now to enter step 3 weeks ahead of schedule, and Windsor's doing well as well, what are your thoughts on the possibility of jumping ahead in the reopening timeline?
Well, I think it is something that is possible in our region, given what we are seeing in our community. But Windsor-Essex is not an isolated community. We have to look at what's happening everywhere else too. And I touched on that how every community is connected with one another. So knowing that the threat of Delta variant still exists in the province, but given what we are seeing, I think we will be okay. But that's not something that I can control. I have already expressed my opinion about whether we are ready. I think we are. But we'll have to wait for the provincial announcement to happen.
Is there any point that you would take that opinion a further step and advocate to the province for more reopening?
Well, I have expressed my my thoughts already with the officials that I generally deal with, recognizing that the province as a whole is making that decision, and then the conversations are happening at that level already. And from my perspective, I have already expressed my opinion, and hoping that at the right time they will consider that and will do the reopening accordingly.
Okay, thank you.
Any questions from Radio Canada?
Yes, good morning. So first of all, I want to say congratulations to Teresa. And there, still about Teresa, I'm just wondering, I guess this year was not exactly what you were expecting for your last year with the health unit.
Well, correct. Last year, the pandemic started, in March, and so, it just has continued on. But yeah, it's been a very busy 15 months, and I think the timing for me is right now, and I am happy to say that our community is in a much better position than we were last year, and have moved through together. We've moved through a lot, through outbreaks and vaccinations. And last year at this time, I was looking back at kind of what I was doing a year ago, and we were dealing with a significant farm outbreak, and having meetings well into the evening to try to make sure people were properly isolated and tested, and here we are today, no outbreaks, and that is significant in our community, and the vaccination rollout is moving quite well, and with lots of opportunity for people to continue to get vaccinated. So it's been an interesting year. I'm happy to have been part of it, and very proud to be here. Okay, congratulations once again. So now I have another question, and I'm very sorry if I missed some of your answers before. We had some people calling us and writing to us complaining about the lack of French services since the beginning of the pandemic, and especially since the vaccination started.
So, do you have any info regarding French services during this pandemic here in Windsor-Essex?
So we do have interpretation services at our clinics, and for other language in addition to French. We have a couple of French-speaking nurses, which we've used in our school program as well. But I know the ministry did bring that up to us, and we do, not to us, like to all health units, to make sure there was access in French. We have a website that is, you're able to get whatever language you choose. So there are specific avenues for people who speak French and other languages. So I'm not sure if that is specific to our area. We haven't specifically received any concerns based on the information we have delivered, which is in both languages. So if you are hearing issues that you want to bring to our attention, please do so. But at all of the mass vaccination sites, they have the ability to use a different interpretation services. It's not a person in person, but it is an electronic means, a virtual means for translation.
Thank you. And once again, I'm sorry if I'm asking the same question that my colleagues already asked. I have an issue with my cell phone today. So I'm just wondering, when do you intend to open vaccination to everyone in Windsor-Essex? Are you going to follow the provincial guidelines and start next week, or are you going to do that a little bit earlier?
So we're doing the background work to aim for Saturday. We did this last week, and if the province is going ahead with the opening it up to everyone and having everyone eligible as of, I believe the target was June 28th, that would be Monday. And our plans, we would like to do it on Saturday because we know we have good resources at our on-call center to assist people as they navigate their appointments. So we are aiming for that. Right now, people are, in our booking system, you need your health card number to go in. If you go through the steps, it asks for your health card number so it can, actually verify that you received your first dose. And so loading up the health card numbers of everyone that remains in the system is the task that our epidemiology department is doing. But they're on target for a Saturday opening if the province allows.
Okay, thank you.
Any questions from CFTV?
Yes, good morning. Congratulations, Teresa. I have a question. If snowbirds get still AstraZeneca doses, how are they going to be able to get to their winter homes in the winter? Because AstraZeneca is not recognized over in the States.
So maybe I'll take that question. It will be. So I think that's the bottom line. There are a large number of people who have received AstraZeneca vaccine, and in Canada, we are accepting any of the WHO approved vaccine, regardless of whether it's approved in Canada or not. These vaccines are effective, and again, I can't comment specifically on how countries make that decision, but I cannot imagine that, especially some of these well-recognized vaccine, if they will not be included as part of the acceptable vaccine regime. And so it will happen. That's all I can say. And it has happened all the time, even with any other type of vaccine. So I know there's more anxiety and more concerns about in people about these vaccines, which brand of vaccine. At the end of the day, none of that matters when we all move into a better spot. So as much as it's causing anxiety, don't. It will eventually happen. I cannot imagine a future when certain vaccines will be accepted and other vaccines are not accepted.
Okay, thank you very much.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AMA 100?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from Radio Canada?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Thank you, everyone. See you on Friday.